Hello everyone. Today I am going to take class on diabetes, its causes and its medication. Especially I will talk about metformin. So what is diabetes? Diabetes is a chronic condition in where the blood glucose level is elevated than its normal range, especially more than 4 to 6 millimole per liter. So when it called diabetes, when the beta cell of the pancreas is not produce insulin properly, then it is called diabetes, because the function of insulin is to metabolize the glucose and also put the glucose into the cell. But in diabetes condition, the insulin is not produced properly. That's why the blood glucose level is always elevated in the blood. There are different causes for diabetes. Especially there are some genes which are responsible for diabetes, and also the physical inactivity, the lifestyle, and also the your food habits are responsible for diabetes. So to control diabetes, doctor are sometimes recommended insulin and sometimes recommended medication. So when they recommended medication and when they recommended insulin, it also depends on the type of diabetes. So there are especially two types of diabetes. One is type 1 and second is type 2. So when we'll call it type 1 or when we indicated it type 2. In case of type 1, the beta cell of the pancreas properly destroyed or fully destroyed and no insulin is produced in the blood. That's why doctor recommended insulin from the outside of the body. And in case of type 1, the doctor recommended insulin as a first line therapy. On the other hand, in case of the type 2, so when it is called type 2? Type 2 is indicate when your beta cell of the pancreas produces insulin in a small amount. So doctor recommended some medication to sensitize or stimulate your beta cell to produce insulin more than the before condition or the past condition. The some classification of antidiabetic drugs are, first of all, the biguanides, which are recommended as the first line therapy, and in biguanides the metformin is the first choice for all doctors in all over the world. And the second classification is the phosphonylurea group, which has mainly three generations: first, second and third. In third generation and third generation and second generation are mostly provided by the doctors. Some examples are the glimepiride, glyburide, etc. On the other hand, some groups are the DPP4 inhibitors, the SGPLT2 inhibitors are also recommended. But I will discuss about metformin, how it works. So as we know, the metformin is the first line therapy for all the patients, for all patients of diabetes. So how metformin works? Metformin especially works in three ways. The first way, it reduces the absorption of the glucose from the stomach. So suppose you took food and it is carbohydrate. So when it enter into the body, it will go first into your stomach. So in your stomach there are motility, and in this motility, stomach motility, the food will be broken into smaller parts. But metformin decreases the motility of your stomach, and the breakdown of the carbohydrate will be slow. When the breakdown of the carbohydrate slowed, the formation of the glucose will be slow, and the absorption of the glucose into blood circulation will be slow, and the blood glucose level will be normal in your blood. This is the first mechanism. The second mechanism of metformin is reduction or inhibition of the gluconeogenesis by the liver. So it acts on liver. So how it works? Liver performs gluconeogenesis, glycolysis and glycogenolysis. So it inhibits gluconeogenesis. So what is gluconeogenesis? The term gluconeogenesis is formation of glucose into your blood from a new source. That means from a fat, from protein. This is gluconeogenesis. So metformin inhibits the gluconeogenesis. So when the gluconeogenesis will be inhibited, the formation of the extra glucose will be inhibited and the blood glucose level will be reduced. This is the second mechanism for metformin. And the third mechanism is the metformin acts on tissue. It stimulates tissue to absorb more glucose from blood to tissue cell. Sometimes it also sensitizes or stimulates the route for glucose. That means it stimulates the route for enter the glucose from the blood to the tissue, by which the blood glucose will enter into the tissue and the glucose level will be decreased. And this is the third mechanism for glucose. And by these three mechanisms, the glucose reduce the blood glucose level in our body and keep the blood glucose level in normal condition. I hope that's all about today's class, and I hope you enjoy this class. Thank you everyone.